Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Please see important safety information at the end of this video and full prescribing information at www.gvokeglucagon.com.
In adolescence, I was a bit of a punk about my diabetes care. I did not like being told, you could have 30 grams of carbohydrates, no more, no less. And my diet quickly consisted of chocolate milk and donuts because those were 30 carbs. And I would freak my parents out. My parents drugged me, literally, kicking and screaming to a diabetes conference. I didn't want to go because I didn't want to meet anyone else with diabetes. But when I got there, everything changed. I had met for the first time other kids my age who were checking their blood sugars. They were giving themselves insulin, or some of them had insulin pumps, were dosing, and the whole mindset of diabetes for me shifted. And I left that conference knowing that I needed to take better care of my diabetes and my health. Before the conference, I wanted to hide diabetes. So I have an insulin pump that has tubings, and I would cut holes in the bottom of the jean pocket so that I could hide the tubing. When I left the conference, I had a sweatband on with my insulin pump tucked into my sweatband. Before I had kids, I was very engaged in my diabetes day-to-day management. Moving forward into fatherhood, time wasn't as available for me. I wasn't exercising as much, I wasn't getting enough sleep, and I really wasn't putting all that focus on myself. So I was focusing more on being a father as opposed to doing the tiny details of diabetes management that I had been doing before.
Kenny's diabetes obviously plays a role in our relationship and in our family, in raising our children. If you've ever tried to get small children out the door, it is one of the hardest things to juggle, and then all of a sudden a low alarm goes off. It always comes up at the most inconvenient times.
I had a severe low in October of 2021. It was just my wife, my one daughter, and I, and it was just a normal night. I dosed for dinner as normal. Noticed my CGM beeped saying that my blood sugar was going down quickly, so I had some juice, and then my CGM went off again saying I was dropping really quickly.
I remember going in to check on him and see how he was doing. And I didn't even have to look at the number of the reading, the look in his eyes it was not just the low, it was a look of fear in his eyes that I had never seen before.
I went from, I believe it was 100 to 40 in the matter of 5 minutes, and I didn't believe it, right? I was kind of like, there's no way that's possible. So I did a finger stick to confirm, and the finger stick was actually in the 20s, and then I had this realization of, this is bad. And that is when I decided to grab Gvoke.
Watching him administer it himself was so calming.
Did you check? I did.
A severe low is the worst case scenario in our day-to-day lives. Being able to have Gvoke available for us in our home, on outings, in the car, wherever we may be, to have that tool with us, that safety net is, I can't even put it into words. It's so reassuring.
I had a severe low when I was a teenager, and then I went more than twice that before having another severe low, and had a third one shortly thereafter. Having those severe lows kind of told me that I need to reshift my priorities, and while I am a new father and have new responsibilities with my babies, I still need to be able to take care of myself, and I still need to prioritize taking care of myself. As a father of young children, it's really important for me to know how to self-administer Gvoke, so I need to be the one able to do that so that I can safely take care of my children.
It's been a really beautiful thing to see how Kenny has prioritized his own care and health after having children. It feels really inspiring and amazing to be able to watch him care so much for his diabetes for all of us. Gvoke has brought so much peace of mind for our family about treating a severe low. They inevitably can happen.
Look like Ellie.
No matter how good your care is on a day-to-day, minute-to-minute basis. And being able to have that safety net available takes a lot of that worry out of our minds.
It can be hard, right? You're learning how to just be a parent, learning how to take care of your baby, and you also have to take care of your diabetes. It's important to make sure that I'm healthy so that I can be there for my children. I want to be around for a long time and experience them growing up.
Indication: Gvoke glucagon is a prescription medicine used to treat very low blood sugar in adults and children ages 2 years and above with diabetes. Important safety information: do not use Gvoke if you have a tumor in the gland on top of your kidneys called a pheochromocytoma because of the risk of a substantial increase in blood pressure, have a tumor in your pancreas called an insulinoma because of the risk of low blood sugar, are allergic to glucagon or any inactive ingredient in Gvoke. Stop using Gvoke and seek immediate medical attention if you experience any symptoms of a serious allergic reaction, such as rash, difficulty breathing, or low blood pressure. Before using Gvoke, tell your doctor about all the medicines you take and your medical conditions, including if you have not had food or water for a long time, prolonged fasting or starvation, have low blood sugar that does not go away, chronic hypoglycemia, or have a history of a skin rash called necrolytic migratory erythema, commonly associated with glucagon-producing tumors. The most common side effects reported in adults are nausea, vomiting, swelling at the injection site, and headache. The most common side effects reported in children are nausea, low blood sugar, vomiting, headache, abdominal pain, high blood sugar, pain or redness at injection site, and hives. Inform caregivers on the instructions for use of Gvoke and symptoms of severe hypoglycemia, which include unconsciousness and seizures or convulsions. Store in original container until time of use and at room temperature between 68 degrees Fahrenheit to 77 degrees Fahrenheit, 20 degrees Celsius to 25 degrees Celsius. You are encouraged to report side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088. Please talk to your doctor and see full prescribing information and patient information guide for Gvoke at www.gvokeglucagon.com.